I do the things because I like to do it. I learned to do that. I learned to do that. I love to see my patient. I love to see to when they need me.
Nora Moreno describes herself as a woman of faith, but says the past year and a half working the front lines has brought many challenges.
When I feel like that, I'm very spiritual person. It is when I go and take my time and pray.
Moreno, a certified nursing assistant for Tidelands Health Waccamaw Community Hospital, tells me she's treated all kinds of patients, including those with COVID-19. She wears a full set of personal protective equipment like gowns, masks, face shields, and gloves. But it's also a delicate balance for patients who are alone and cannot be visited by family. That's when she steps in to give her patients the comfort they need. Delma Ham, a trauma unit nurse at McLeod Regional Health Center in Florence, has already lived the experience. She tested positive for the virus last year.
So it was not only the patients getting sick with COVID, but we as nurses were getting sick with it too.
Last year, when the pandemic started, it was scary for those working the front lines with little knowledge and treatment available at the time.
This is kind of how it is today as well. And back then it was even scarier because we knew very little about COVID. We didn't know what could happen to us if we did get COVID.
Ham says she is pregnant with her first child. She says her husband also works the COVID unit at a hospital, constantly exposing them to the virus. She says she is taking all precautions to protect her child and family.
We worry a lot about, our child and what if I get COVID from work? What if he gets COVID? And, what could happen to our baby or to my pregnancy? So it has been very scary.
Both Moreno and Ham say hectic long hours can take a toll physically and emotionally. But they say it's their passion to help their patients, and their hospital management team has been very supportive.
Doesn't matter what it is when you have a good crew, when you have a team like they supporting you, and they because you don't work by yourself, so you work and engage with them, so that is nice.
There was a lot of teamwork done, and we were able to do our best, and everything luckily turned out. It was not easy, but everything worked out.
Reporting for News 13, I'm Stephanie Fernandez.